31-year-old female presented for evaluation of white lesions all over her mouth. She said she has had these lesions for 2 years. Her mouth burns while she eats spicy food. For the history of present illness, the onset of these lesions began about 2 years ago. The location is all throughout the mouth. The pain associated with these lesions is only when eating spicy foods. The severity of the pain is mild. The causation is unknown, and modifying factors that make the pain better is not eating spicy foods, and what makes it worse would be eating spicy foods. This patient has no medical problems, is currently taking no medications, no allergy, and no surgeries or hospitalizations. The extraoral exam was all normal, non-contributory. For the intraoral exam, the lesion location was on the buccal mucosa on the right, the gingiva, right, left, upper, lower, buccal, lingual were also noted to have these lesions. The lesion colors were white and red. The shape or growth pattern was ulcerated. The texture was soft, and the border or margins were poorly defined. There were diffuse, generalized erythematous, poorly defined desquamative lesions noted on the attached gingiva, especially on the lower left side, and diffuse reticular white lines noted on the lower left attached gingiva and right buccal mucosa. The other tissues in the intraoral exam were all normal. I diagnosed oral lichen planus, and for the treatment plan, the pathophysiology of the condition was explained to the patient, and the patient was informed that we will start her treatment today if after applying medication for 2 weeks she did not have any improvements. We will perform a biopsy at the next visit. So the medications that I prescribed were dexamethasone elixir, 0.5 milligrams per 5 ml, dispense 320 ml, swish with 5 cc's for 30 seconds and spit out the excess. I also prescribed Lidex gel, 0.05%, 1 tube. Apply a thin layer to the painful gingiva 3 times a day. Now we'll follow up with this patient in 2 weeks. So what is lichen planus? So this is a disease of the skin and or mucous membranes with unknown cause. However, it's believed to be an autoimmune disease. In the oral cavity, there are 2 main types of lichen planus. Reticular, which is like a lace-like pattern of fine white lines, which are usually painless, as seen in the below picture in the buccal mucosa. And there's erosive lichen planus as well, where you see erosions or ulcerative lesions that are usually quite painful. This patient has a mixture of both. Well, what does the literature say about the prescriptions that I prescribed for this oral lichen planus? There was a study done on dexamethasone. In this study, the levels of pro-inflammatory cytokines were measured, specifically TNF-alpha, interleukin-1 alpha, interleukin-6, and interleukin-8 within the saliva of patients who had oral lichen planus. 13 definitively diagnosed oral lichen planus subjects were enrolled in the study, as well as 13 controls. The oral lichen planus subjects were treated with 0.1% dexamethasone oral rinse for 6 weeks. Prior to treatment and at the end of the clinical trial, the VAS for symptoms was recorded, and the saliva was collected, and these pro-inflammatory cytokines were analyzed by ELISA. The results of this study showed that dexamethasone group levels of TNF alpha, IL-1 alpha, IL-6, and IL-8 were all decreased significantly. And IL-1 alpha and IL-8 were detected at a level without a statistically significant difference from controls. The VAS value was decreased significantly and was found to significantly correlate with the decrease in IL-1 alpha and IL-8 levels. Well, how about the Lidex gel? In a randomized double-blind placebo-controlled study, the efficacy of topical application of 0.025% Lidex gel was evaluated. 40 patients with oral lichen planus diagnosed on the basis of histopathologic and immunofluorescent findings participated in the study. In the group of 20 patients that received the drug, 4 patients showed a complete remission. 12 patients had a good or partial response to the topical treatment. In the placebo group, these findings showed the majority of the placebo group did not respond at all with regard to the signs and symptoms. So for these patients, when the lesions are all throughout the mouth, a dexamethasone rinse is quite effective. And if they have any specific areas that are more painful, they can actually apply the Lidex gel in those areas.